What's happening, everyone? Dr. John SCHOTT here with Balanced Physical Therapy. So today we're going to talk about something called pelvic alignment. So it's a little bit of an out-of-date term in that it used to be that the healthcare professionals would use the term that your pelvis can become rotated or like out of place. And recent research has really come around to say that that actually doesn't happen, at least for an average person. In pregnancy, we can see that the ligaments can loosen up basically to increase space for the birth canal. But for the most part, your sacroiliac joint and your pelvis are really a very strong and stable structure. So the idea that these can become put out of alignment, or what we refer to as become anteriorly rotated, posteriorly rotated, or even upslipped or downslipped, are now outdated and really is believed to not actually happen. But when we do some of these old palpatory tests, we actually find that you can still see that it seems like that is happening. And what we've actually figured out is that it's really due to muscle activation, in that we can have muscles on one side of the body that are a little bit tighter compared to the other side. So in the traditional physical therapy realm, the way that we can do this is lay you down on a table and then look at how your legs compare to each other. And sometimes we'll find that maybe one's right leg is a little bit longer than the left leg, vice versa. And so I'm going to show you a simple way for you to do this, in that you might have one side of your body that's a little bit tighter than the other. And a good way to fix this it's good to fix this before you're doing some sort of physical activity, exercising in the gym, so that you feel a little bit more even. So I personally know that my right side my left side seems to be a little bit tighter than the right. So what I will do is I'll just kind of set myself up in terms of getting into a normal stance position, and then seeing where my feet end up on the ground. And for me, my right leg ends up a little bit more forward compared to my left side. So that could mean that potentially, the muscles on my left side are a little bit tighter. Depending on which side of my pelvis is a little bit tighter, it can vary. And I don't want to get into the details of it, but either way, if you do feel this, sort of lopsidedness, if you do notice that you naturally sit with one leg a little bit more forward than the other, this is a quick way for you to essentially treat that for yourself. So I'm going to say, regardless of how your leg sits, you can do this to both sides, okay? But for this example, where it feels like my right side is a little bit longer than my left, this is how I'm going to do it. So find yourself on the near a wall, and what you're going to do is you're going to lie down on the ground, and you're going to put your legs up against the wall. So I ideally want my hips to be at about 90 degrees and my knees to be at about 90 degrees. And so what I'm going to do is I'm going to push into the wall with my right leg, and then I'm going to push into my hands with my left leg at the same time. So how that's going to look is I go into the wall with my right, and I lift up with my left. I'm just going to hold it for about 2 to 3 seconds and relax. Push down, lift up, hold, relax. Push down, lift up, relax. For the sake of this example, we could actually just do it to both sides. So I can go ahead and switch to the other side, pushing up with my right leg, pushing down with my left, holding, relaxing. I like to finish with a little adductor squeeze as well too, so I can just put my fists in between my knees, squeeze, relax, squeeze, and relax. And then what I'll do is just stand up and do a little post test. So I'm gonna find my footing, try not to look down and really notice where I'm standing, and then see how my foot position changes. And for me, it looks like it's a little bit more even now. So again, we can get into the nitty gritty of, is your, pelvis out of place? Are your muscles on one side tighter than the other? Really go based off of feel. If you feel like, one side just feels more tight than the other, using this, what we call an isometric contraction, can help to make your lower body just feel a little more even. So when you go into those exercises like squats, deadlifts, anything like that, it makes it so you feel primed and ready. So if you found this video helpful, please make sure to give us a like and follow us on YouTube, Instagram, and Facebook at Balanced PT Move.